Hey community, this is Dr. Hugh coming at you, and today I have another webinar, and it is going to be on brain-based problems. And this is really significant. I've been doing a lot of research on this topic and helping a lot of people with brain-based injury. And one of the most common areas that will get damaged is part of your brain called your cerebellum. Now the whole workshop, the webinar, is going to be around your cerebellum, the significance of the cerebellum, what can happen when you have when your cerebellum gets damaged, and what you can actually do about it. So some of the really common themes here of cerebellum damage is brain fog, fatigue, fear, anxiety, vertigo. So there's lots of problems that can be caused if you have a cerebellum issue. Now here's really more specific issues that can happen when you have a cerebellum issue. So if you have any of these symptoms at all, this would indicate that your condition, your brain-based condition, has probably a component of the cerebellum involved. So for example, dizziness, vertigo, double vision, constipation, diarrhea, racing heart, balance problems, tremors, abnormal sweating, anxiety and nausea and sound sensitivity, or like a sense of doom, depolarization. If you're suffering from any of these problems, there's a probability that your cerebellum is probably contributing to your neurological problems. Now let me go over these statistics right here, because this is pretty shocking. So what you're looking at right here is, this is a brain, right? So we have the brain, and then right down here we have the cerebellum, the red part. Now the cerebellum is literally located right here, and it's probably it's like as big as my fist. Now to give you some understanding of the significance of the cerebellum. So in the whole brain, there's roughly 86 billion neurons in your brain, in the whole entire brain. Now check this out. Just within the cerebellum, just within this red area right here, there is 70 billion neurons. So the whole brain has 86 and your cerebellum has 70. So more than 80% of your neurons are located in your cerebellum. This is why the latest research is showing if you have any problems with any kind of brain inflammation, dysautonomia, any weird neurological symptoms that no doctor's ever been able to explain, you probably have a cerebellum issue and no doctor's ever addressed it or actually had the skill set to address your cerebellum problem. So this is a really good visual. I like a lot of visuals right here. You can see right here, this is the cerebellum, and then you can see the rest of your brain, which is what we call the cortex. So everything else here is all the cortex. And then down here, back here is called the cerebellum. So you can see here the cortex right here, the cerebral cortex, and then the cerebellum. So let me just go over so you can see this work, because it's really easy to get confused right here. So the cerebellum right here is right behind your head, and then the cortex, we're talking about everything else besides the cerebellum in general terms. So you can see like some nerve, some organ in your brain that has 80% of all the neurological centers is very significant. You got to make sure that this is definitely healthy. Now here's the research on that. If you want to go look at that, you can look at that. And again, I just like to have some visuals here. So you can see right here, here's the cerebellum right in here. Here's the cerebellum in here. And then all this other part here is what we call the cortex. Right, so the cerebellum is actually the master system of your entire nervous system. Here again, these are just some more visuals. I like visuals so you can see. Here's the cerebellum. There's your nose. There's the back of your head. Here would be your eyes. So just to give you some orientation. Now, what the heck does the cerebellum do? When it comes to your brain, and the gatekeeper, let me say this again, the gatekeeper of your whole entire brain is your cerebellum. That is the gatekeeper. Now, when it comes to your brain, most of your brain activity is to actually stop or slow things down, believe it or not. It's not to speed it up. It's to slow things down. So when we talk about, let's say, a healthy cerebellum right in here. When we are going to drive a car, I'm just going to use an analogy. When we're driving a car, and we can completely brake the car to actually 90% brakes. So what the cerebellum does is it slows down things. It's your gatekeeper. So the cerebellum slows things down, just like grandma driving in front of you. They drive slow, right? So that's what we want. We want your cerebellum to slow down things and gate things properly to let things in and let things out. Now, when you have a damaged cerebellum and all those neurological symptoms that we just went over right here, all these things up in here, this would indicate that you possibly have a cerebellum problem and no one's actually addressed your cerebellum. So when we have a cerebellum that isn't gating properly, it's letting a lot of things out, right? So a lot of things get out and then you're on hyperdrive. So in this first picture here where it's slow, our car is virtually at a stop. We have 90% on the brake, 90% on the brake. And then down here, when you have a bad cerebellum, the fancy word for weird neurological problems is just called dysautonomia, okay? But at the end of the day, it just means like you have weird neurological symptoms that no doctor can explain. That's a cerebellum problem. So when you have that, what happens is your cerebellum cannot gate and it's running the red light, right? So when you're speeding, right, you're gonna run red lights. You're probably gonna get in more accidents, right? Things just happen. Accidents happen when you're at a faster speed. So this is what happens when you have a poor cerebellum. Things are going out into your different parts of your brain at a much higher pace than what should happen. And when this happens, you get weird neurological symptoms that no doctor on planet Earth can explain except Dr. Hugh, which we're doing right here. All right. So I just like to use some analogies. So the green part right here is this is your cerebellum right here. And we're going to say your cerebellum is the quarterback. Okay, this is Tom Brady. If you know anything about quarterbacks, as of right now, Tom Brady is, in my viewpoint, the best quarterback ever to live. Now, you might think Joe Montana is the best quarterback. Okay, we can differ on that. But for this sake, we're going to say that Tom Brady is the quarterback. He is our cerebellum. So with cerebellum output, throwing to the receptor, we want very good accuracy. Now, if we don't have good accuracy, bad things happen. Now, I'm not trying to make you an anatomist here. I'm just trying to give you some basic maps, right? So if you're going to drive, if you're going to take a vacation and it's 1,000 miles, you're going to put the location in your iPhone and you're going to have a GPS and it's going to route exactly where you're going to go. So let me go over some basic neurological pathways that make certain pathways go the way they should. All right. So right in here, you're going to see this would be your nose right here. Okay. This is your eyes. Right. So we have your eyes. And then we have this thing right down in here, which is called your vestibular apparatus. That's a fancy word for saying there's things in your ears here that give you balance. Now, just to show you some of these pathways. Now, right down in here, we have that cerebellum right in here, right? Now, let's look at these pathways right here. So you have your eyeball, all right? Now, your eyes have, check this out. Your eyes have 6 different muscles. So 6 muscles here, 6 muscles here. You see me moving my eyes here? Okay, was that really cool or what? Okay, so moving my eyes took 6 muscles here, 6 muscles here, and then it took three different nerves, right, in my skull here to control these muscles. So it's pretty complex. 6 muscles, 3 nerves, right? So we have 6 muscles here, 6 muscles here, 3 nerves on this side, 3 nerves on this side. So this is a very, very complex system. So now this system, you can see how these little nerves right in here, they go to this mechanism right in here, which is your cerebellum. Then your cerebellum coordinates your muscle activity. So if you have a bad cerebellum, if your cerebellum is bad, your cerebellum tells your eyes where to look and how to be very, very efficient with your eyes. Now, if you ever get car sickness, that could be a cerebellum problem because you have a whole bunch of inputs coming into your eyes. These inputs have to go to your cerebellum, and the cerebellum tells your muscles in your eyes to turn on or turn off. So this is a very finite system. It's made with a lot of precision. If your precision is off, you're going to have headaches. You could have dizziness. You could have vertigo. You could have nausea. You could have vomiting, right? All these things can happen when you have a bad cerebellum. Okay, so in here, now when it comes to your balance centers, this would be your balance centers. Again, you can see how this goes right in your cerebellum, right? And then your cerebellum has to coordinate. I just moved my head this way. These nerves go to your cerebellum and tell the rest of your body, the rest of your brain, hey, I moved my head to the right, right? So the cerebellum is very, very critical. Now look at this right here. Then there's actually nerves from the cerebellum that go down. You see this right here? They go down your spinal cord, down into your legs, into your hands. If you've ever gone to reach something and you're shaking like this, that's tremors. That can possibly be a cerebellum problem. Same thing with like walking in a straight line. If you lose your balance, that can possibly be a cerebellum. Or when you get up in the middle of the night and you have to go to the bathroom, and if it's really dark, you can't feel your way around, that can be a cerebellum. So the cerebellum is very, very critical. Again, here's just another pathway. You can see all these pathways that are coming in. So you see here sensory signals. Well, what the heck does that mean? Well, your feet have basically, they have senses. They have like vibration. They have vibration. They have temperature. They have hot, cold. They have pain. And all these things, guess what? They go right up into your cerebellum, and then they go up into the rest of your brain. So the cerebellum is the quarterback. Now, let's say here you have a cerebellum that's weak, and you have fibromyalgia. You have all this pain fibers coming up here to your cerebellum. And remember, your cerebellum stops things. So if your cerebellum cannot stop the pain from your brain perceiving pain, what's going to happen to your pain perception? It's going to go up, right? So this is why a lot of people, one cause is when people have fibromyalgia because their cerebellum is not well. Now in here, this is just a graphic that I just want to kind of show you right here. All right, so remember here, we have my favorite quarterback, Tom Brady. Cerebellum. Now within your brain, there are many different, it's a very complex system, right? So I'm just going to try and simplify this. So in this area right here, right, this is called your midbrain. And the reason why it's called your mid, because this is the upper, this is the lower, and that would be the midbrain, okay? Now within here, within this center right in here, this is where all your anxiety centers are. So let's say Tom Brady here has a bad day and he throws a pass that should actually come up to this part of your area here. But this pass is an interception and he throws it right in here. This is your stress and anxiety centers. So what could happen? You could get a racing heart. You could get a stomach that is like you feel like you're going to vomit. If he throws an interception in here, and these nerves here control your balance centers, right? He's throwing the ball and it's hitting your balance centers in your brain. You can be off balance. Your eyes, let's say here he throws a pass and it should go here, but it goes up to this area right here. And now your eyes aren't tracking properly. So when you need to track, you need to focus on something. And when you can't focus on something, you get a headache, you get a migraine. You get brain fog. Your brain requires lots and lots of energy. And if your eyes can't, when I move my eyes back and forth here, right? When I move my eyes and I'm looking right at you right now, I'm looking on one object. But remember, we have these 6 muscles here, 6 muscles here, 3 nerves here, 3 nerves here, and they all go back to Tom Brady, and Tom Brady needs to coordinate that. And if he cannot coordinate all those things, your eyes are going to be off just a slight bit. And you can have all these different weird neurological symptoms because of that. Let's say Tom Brady throws a pass like right down in this area of your brain, which is called your brainstem. That can cause you to have your pulse that goes up. So one of the things that you can do, you can have someone flash the lights on and off, just like this. And if your pulse goes up, that can be because you have some kind of weird cerebellum problem or damage in there. One of the things that's really common when people have cerebellum problems is they can have light sensitivity. Because not only do your eyes need to move right in the right direction to see an object, but if light comes in there, Right? If light comes in there and it goes down to the cerebellum and Tom Brady can't handle that, it can't handle that light that's coming in because the cerebellum gets information, right? And then it needs to dish it out. So this is a little player over here. Tom Brady sees that. He sees that player right here, right? And then the cerebellum, Tom Brady has to coordinate it and send that pass out. So it's a two-way system. It's back and forth. So if you have a weak cerebellum, like if you go into the store and your eyes like, oh, bugging out, and you can't look at the light, that's because your cerebellum can't gate. It can't take down that light, so your brain gets overstimulated. Same thing here with sound, right? If you're like, I hate that sound. This can be because the sound, same mechanism here, goes in your cerebellum, and your cerebellum has to gate that. It has to allow your brain to accept it. And if it's weak, if it's been damaged, it goes in here and it fires into these different stress centers in your brainstem and cause a wide variety of problems. So just with this, we can have a taste problem. We can have pain. We can have smelling. We can have hearing problems. We can have dizziness. We can have constipation because there's a big nerve that sits right down in here, called your vagus nerve, sits right down in here, and the cerebellum stimulates the vagus nerve. So you can have constipation. You can have diarrhea. You can have poor balance. You can have neuropathy. You can have the inability to actually perceive your feet and your legs because you have a poor cerebellum. Okay, so this right here, I wanted to show you some research studies on this. So you can see here, this comes from 2022, and it says inflammation from peripheral organs to the brain. How does systemic inflammation cause neuroinflammation? So neuroinflammation is just saying that your brain's inflamed. So I'm going to kind of read this. Now, a lot of people come to me and they have their brain that's inflamed, they're depressed, their anxiety, they have depolarization, they have gut problems, they have anxiety, they have a whole bunch of different stuff, right? And your brain's inflamed and your cerebellum is inflamed as well. So I'm just going to read this. As inflammation in the brain contributes to several neurological psychiatric diseases, the cause of neural inflammation is widely being studied. The causes of neural inflammation can be roughly divided into the following things. Viral infection. Maybe you got COVID and you haven't recovered, right? That's possible. Maybe you have autoimmune disease. Most of my patients come to me, my clients have some kind of autoimmune disease and it affects your brain. Autoimmune disease against your cerebellum. Not good. Inflammation from peripheral organs. What the heck does that mean? Well, for example, normal bowel movements should be 2 to 3 bowel movements every single day. No gas, no bloating, no diarrhea. If you get distended, if you get bloated, if your gut just feels like crap, you have a mechanism of inflammation that can cause your brain to be inflamed as well. Not good. Mental stress. Who's not under mental stress? Under mental stress. Metabolic disorders. Well, what would that look like? Well, in blood work, maybe you have a high A1C, which is a marker for sugar. Maybe you have high sugar levels. Maybe you have low vitamin D. Maybe you have low magnesium. Maybe we do blood work and we check all these things and you have, you're severely inflamed. Right? Maybe you're sensitive to eggs or dairy or gluten. All these things will cause neuroinflammation and cause your cerebellum to be more susceptible to damage. And then it just lets everything go, right? It's like the finale of the 4th of July, right? So everyone, you wait for the finale. Why is it? Because all the fireworks go off. If your cerebellum is not working properly, you have a finale all day long. You wake up with a finale. In the midday, you have a finale. At night, you have a finale. You're stressed out. All these weird neurological symptoms are going crazy. Okay? Okay, now look at this. Many diseases such as gastrointestinal inflammation, chronic obstructive pulmonary disease, rheumatoid arthritis, dermatitis, which is a skin problem, chronic fatigue syndrome, basically this is a fancy word for fibromyalgia, trigger inflammation through several pathways in your body. So one of the things is when anyone comes in with a neurological problem, we are trying to handle these systemic inflammatory processes that are going to occur. And there's many things that we can do for that. Here's just another research study that's just saying that your cerebellum can contribute to basically things like anxiety, depression, panic attacks. I just want to show you that there's actually research studies on this right here. Here's another one, the cerebellum and anxiety. And I'm just going to read this to you. So the cerebellum was, 20 years ago considered just a motor, just would coordinate motor things. Like if you're out going to reach something, if you're going to touch your nose, it was just motor. But it's way more than motor now. So one such non-motor function is anxiety behavior. A series of recent studies now implicate the cerebellum in anxiety. And this right here, this is a brand new study, 2023. These are brand new things that the cerebellum is being researched and shown. Hey, yeah, if you have anxiety, you probably have a cerebellum problem. All right. So what can we do? What are some tests, some simple tests that you can go do at home? Well, this is what we call tandem walking. So you see here how you walk? It's called tandem walking. So it's called tandem walking, and you just walk in a straight line. Do you have good balance? If you walk in a straight line and you're falling over to the right or to the left, this is a cerebellum problem. So you can simply do this, right? Now, let's say you can do that. Now what you want to do is you want to close your eyes. Can you actually close your eyes and walk in a straight line? If you can't, that's a cerebellum problem because the cerebellum perceives your feet, and that goes up to the cerebellum. It says, hey, I know where my feet are at, right? But if you have poor function, it can indicate that you have a poor cerebellum. Same thing like if you get this little swivel chair I have right here. Swivel around in this chair a few times, and if you feel anxious, if your heart rate goes up, this is going to tell you that you probably have a cerebellum problem. Or nausea, right? Especially, driving a car, you get nausea. Here's another thing. You see this nose, you want to hit your nose, right? So this is another test. So you just bring your arms out, just like you see my hand. Oh, you see my hand right here? You bring it out, and then you bring it to your nose. Can you bring it to your nose? Very, very slowly. You don't want to do this heavy. You want to do it very slowly. And then close your eyes. Can you do it with your eyes closed? So this is where you put more stress on your brain when you close your eyes. Now, if you do this and you close your eyes and you're up here, that's bad. Right? That's telling you that your cerebellum's not right. Or if you close your eyes and you see this, or someone else can see this, this is endpoint tremors. This is tremors. This is not good. This indicates cerebellum. Now, we're not going to find anything like that because that'd be very obvious that you have some kind of neurological problem. But when you come here, if you're tremoring like this on your nose there, that tells you that that's a cerebellum problem. That's an indicator. So if you have that, you can have an array of weird neurological symptoms that no one can describe because no one's an expert in cerebellum function and rehabbing. So these are some really basic things that you can do. Just here's another research study is basically, it's just saying that the cerebellum can be due to basically attention deficit disorder, autism spectrum, schizophrenia, bipolar disease, major depressive disorder, and anxiety. So this is like research stuff. This isn't like, some like thing that you're seeing in Time magazine. This is research clinical stuff that the cerebellum. Also, the cerebellum is very sensitive to not enough thiamine, which is B1. And I'll be discussing that in a little bit, but I just want to show you this research article. Now, what are some things that can cause cerebellum problems? And I'm going to list these. There's more here, but low vitamin D. Poor gut health, we talked about that. Poor cellular membrane. If you feel that you're inflamed at all, you have poor cell membranes. Concussions. And you don't have to be knocked out. I'm just talking maybe you got rear-ended. Maybe you played sports and this is 20 years later. You played volleyball and you got hit on your head, or maybe you played soccer. Some kind of mild trauma on your brain could be repeated, or you could be just knocked out cold. Could be use of antibiotics, right? Fluoroquinolones, amoxicillin. You could have food sensitivities like gluten and dairy. You could have low blood pressure. If you have low blood pressure, you're not getting blood to your cerebellum. You could have low blood sugar, hypoglycemia, which is very, very common, I find. You could have what we call subclinical anemia, which means that you can't be diagnosed with being anemic, but you don't have enough really robust iron. And what does iron do? It delivers oxygen. So let's say you have low blood pressure, which I find this a lot, especially in thin women. Low blood pressure, low blood sugar, and then subclinical anemia. I call this the triple threat. So if you have those, you're going to have depression. You're going to have anxiety. You're going to have dysautonomia. You're going to have vomiting. You might have ringing in your ears. You might be sensitive to smell or sound. Why? Because your brain's just not getting the nutrients that it needs. You could have high inflammation on your labs. You could have low magnesium. You could have mold in your house. You could have heavy metals, stress. There could be some kind of autoimmune disease against your nervous system, which is really, really common. You could have a gut problem where you don't have enough hydrochloric acid. You could have high insulin, and here you could have a thiamine deficiency. You could have low status and low vitamin D status as well. Vitamin D or not getting enough fatty acids and fish oil. So there's lots of things that need to be looked at. So it's not as simple as, hey, what's the protocol? Like when I look at clients, it's not all about protocols. It's actually working with physical medicine. So for example, like if you have low blood sugar, there's not a protocol for that. You have to handle that with dietary lifestyle. But you have to know if you are hypoglycemic or not. You have to rule that in or out. If you're hypoglycemic and you're doing all these other things, you're not going to get better. If you have subclinical anemia and you're spending thousands and thousands and thousands and thousands of dollars, you're not going to get better. So there's basic fundamental things that need to be in before you start climbing the tree and looking for things that are higher up in the tree. I always talk about the low-hanging fruit. Go after the low-hanging fruit first. And that's really not very sexy, right? So figuring out if you have hypoglycemia, that's not a sexy treatment, right? So it doesn't get any attention. Instead, some people are going, I want to do peptides. I want to do stem cell. Well, that's way up on the tree. Let's start with the basic things first. Okay, so when it comes to thiamine, B1, this is the product that you want to get right here. This right here, bentotiamine, which is basically B1 is thiamine, but this is a critical thing. It is fat soluble. Now, why does that matter? Because guess what? Your brain is completely what? Fat soluble. We just talked about that article that shows that people that have cerebellum issues can be deficient in thiamine. So you want to get bentotiamine because this is a fat and water soluble. See, so it's fat and water soluble. So it can be highly, highly absorbed in your brain, in your cerebellum. Same thing with this. I like this product, alpha lipoic acid. Why? Because this is fat soluble, it's water soluble, and fat soluble. It's both things. So you're literally killing, what, two birds with one stone kind of thing. So when you come up with a treatment plan, you want to do a polytherapy approach. So I'm not saying that these are the two magical things. I'm saying that these things get results because they actually deal with your neurological tissue, and it's water and fat soluble. So for example, this is a B vitamin, right? This is a B vitamin, B1. These are generally water soluble, meaning that it's very, very hard for that B1 vitamin, because it's water soluble, to get into your brain tissue. But if we have a product that is fat soluble and water soluble, now we can have a very huge impact on your brain. So let me just kind of give you a scenario. Let's say we have someone that is really sensitive to fruit, right? And their gut is always bloated. And we say, hey, just get off of fruit. Just start eating meat and vegetables for 4 weeks and see how you feel. Let's start giving them some fish oil and some bentotiamine and see what happens. Right. And then on top of that, we can also do cerebellum exercises. And I do this online, and we come up with a very specific program on how to exercise your brain. Because it's just like going to the gym. If you go to the gym and you're going to start off with 10 pounds doing bicep curls, and you do it for a year, and at the end of the year, maybe you're going to be at 30 pounds. This is building the strength of your bicep, or you're building the strength of your neurological system. So there's very specific exercises that you can do to strengthen the neurology between your brain and your cerebellum, or wherever that is, between your feet and your cerebellum, your hand and your cerebellum, your eyes and your cerebellum. There's a lot of things that can be done to strengthen that pathway. Now, if you do the metabolic approach and you do the physical approach, doing some of the physical exercises, and there's a bunch of other things that I put in cases, you can actually strengthen your brain, decrease inflammation. And when you decrease inflammation, then your brain gets strengthened, and now you can exercise your brain with very specific protocols and exercises, and you can get better. Okay, so I hope you enjoyed this. If you're out there suffering, I just want to let you know, you do not need to suffer. God did not design you to be unwell. So you go to my website, my name, Dr. Hugh Wegworth, really, really simple. It should be somewhere around where you're seeing this video. You schedule a Zoom call, and I help people all over the world, just like yourself, get well and get better and get results. So with that being said, take care. My name's Dr. Hugh Wegworth. Bye-bye.